Often hear some say they're suffering from a broken heart after a traumatic event, and guess what? That's not just the saying. WDSU medical editor Dr. Corey Hebert explains in this morning's Weekend House Call.
Johnny Cash died of complications related to diabetes, and while strictly speaking that may be the case, many fans believe it was broken heart syndrome that actually caused his death. After all, the iconic musician died less than 4 months after his wife, June Carter, passed away in 2003. Broken heart syndrome, also known as stress cardiomyopathy, can aggravate a person's existing health problems. This happens because the syndrome puts stress on the heart, which eventually affects the health of the whole body. This stress often feels like a mild, continuous heart attack and can cause heavy pains in the chest that last a few days or, in some cases, a few months. The feeling of a heavy heart is caused by the body's overproduction of various chemicals and hormones, including the stress hormones epinephrine and norepinephrine. When these hormones flood the heart muscles, they can become temporarily enlarged. This can make the heart unable to pump correctly. In addition, the stress hormones may cause the arteries to narrow, causing restricted blood flow. Epinephrine can also bind the heart tissue, causing calcium to enter the cells, which stiffen the heart muscle. Broken heart syndrome typically occurs after a stressful event, such as the death of a loved one, a divorce, breakup, or even moments of sudden fear, extreme anger, and surprise. Research shows that in the week after a loved one dies, the risk of heart attack skyrockets 21%. Since the symptoms of broken heart syndrome are similar to heart attack, which are sudden chest pain, shortness of breath, and irregular heartbeat, it can be mistaken for one. However, heart attacks are typically caused by blockages in the arteries, whereas broken heart syndrome, there are no actual blockages, just reduced blood flow due to the stress. It's often diagnosed with the use of an echocardiogram, an EKG, and a blood test, also an overall physical. Research shows that more than 90% of cases have been reported in women over the age of 60. Yet and still, the syndrome can occur in younger women and men. After all, they too can have their hearts broken. Luckily, broken heart syndrome does not always lead to a heart attack or worse. In fact, it has been known to clear up anywhere from a few days to within a few months. So if you have any of the symptoms I mentioned, please see your doctor and realize that even though you may have lost someone you love, life and furthermore, a happy life should and must go on.